Hello everyone, today I'm going to be demonstrating to you how non-disposable items are being transferred out of the isolation center in a medical facility. An isolation center refers to a place, usually in a medical facility, for separating people with a contagious disease from healthy people. This shows that the equipment used in this unit have to be handled properly, either by disposing them or ensuring that they are safe for reuse. However, today I am going to be concentrating on the instruments that can be reused. These instruments are divided into three major categories. The categories are critical devices, semi-critical devices, and non-critical devices. Critical devices are equipment that come in contact with blood and sterile tissue, such as surgical forceps. Semi-critical devices are devices that come in contact with mucous membranes, such as endoscopes. Non-critical devices are devices that come in contact with unbroken skin, such as blood pressure cuffs and thermometers. These equipments are required to undergo specific and thorough sanitary and sterilization processes, which is normal because we're dealing with possible contamination of bacteria. Now, let us take a look at the steps ensuring the reuse of this equipment and how they can be transferred from an isolation unit. The first step is to protect yourself. This is a very important step in handling materials that are being transferred from an isolation unit. This is because it will help to limit the spread of disease pathogens that might have been gotten from the isolation unit. You should put on your nose mask, put on some gloves, put on a protective apparel such as a laboratory coat, put on a head covering. These equipments will help to limit the spread of pathogens and bacteria that can be gotten from the isolation unit. The nose mask, for example, will prevent the medical practitioner from being exposed to diseases that are contagious, that are airborne, while the gloves will protect direct contact with any form of disease pathogens that might be on the equipment that are being transferred from the isolation unit. This step is very crucial and important while handling materials and equipment from the isolation unit. The next step is to carefully and cautiously collect the instruments from the isolation unit. Moving on to the next step, called the decontamination process. Decontamination is a cleaning process to remove blood, protein, particles, and microorganisms present on an equipment. This method is crucial in ensuring that patients are not exposed to disease-causing pathogens when the equipment are being used again. Please note that the decontamination process of critical devices is different from that of the non-critical devices and the semi-critical devices. The critical devices are being soaked in special enzymatic solutions that will loosen and break up bodily fluid. On the other hand, non-critical and semi-critical devices are cleaned separately by special solutions. The equipment are collected on carts and pushed into a washing or disinfecting machine such as a Jetsinge 88 turbo machine. These machines whip around extremely hot water for 20 to 45 minutes, spray the equipment with powerful cleaning solutions, and coat the instruments to keep them in top working conditions. And other non-critical devices such as bedspreads and pillows are transferred to the laundry for proper washing. The next step is the sterilization process. Sterilization is the method of exposing medical equipment to steam, ETO, and chemical agents to properly ensure the safe reuse of those equipments. However, before these equipment are sterilized, the health practitioner handling these equipment should sort them into the appropriate categories for easy reuse and sterilization. The sorted equipment should be placed into an industrial steaming unit for final sterilization at a temperature of up to 274 degrees Fahrenheit. The next step is the storage process. The sterilized equipments are wheeled on sterile carts into the storage rooms where they are kept for reuse. The final step is to discard the materials you used in the isolation unit and to wash your hands properly. Unlike the materials that were being transferred from the isolation unit, These materials cannot be reused because they must have been exposed to certain disease-causing pathogens during the transferring from the isolation unit and during the sterilization, decontamination, and all the cleaning processes that were involved in the transfer. Wash your hands properly with soap and water to minimize the risk of infecting yourself and other patients you might have to attend to. These methods are really important in order to prevent reinfection and the spread of harmful bacteria. Prevention, they say, is better than cure.